Hi, this is Dr. Bob Dannenhoffer, Public Health Officer from Douglas County. As you can tell, we're going to be talking about masks today, so I'm going to take this down so the people who read lips can actually read my lips. Also, I really hate wearing a mask. Anyway, so Dr. Bob Dannenhoffer, one of our Facebook Live events. Lots to talk about tonight, but also we want to answer your questions. So please send your questions in on the comment section. Our call screeners here will get those and give them to me, and I will go through. But let me start off with a few things. The first is the mask, as you see. This is another one of the lovely masks my wife has made, and she is donating to Oregon Serographics. And then they are going to give these masks to hospitals, clinics, EMS, and other people around town to distribute to the patients. So the guidance on masks has changed yet again. So if we tried to confuse you about masks, I don't think we could have done a better job. But so it started off with the Surgeon General saying, oh my goodness, don't buy masks, they don't help. And then there were some people said they did help, and then they said people they didn't help. And today the CDC came out with a recommendation that people wear masks in public. So what is this all about? So the story is masks do slow down the transmission of germs between people. And that's why obviously doctors wear them in the operating room, and while we wear them in the clinic. Masks are actually most effective in preventing you from giving something to somebody else. So the reason doctors wear masks in the operating room is not because they think the patient on the table is going to make them sick. It's so they don't spit into the wound. And I know that's gross, but that's actually the reason why doctors wear masks in the operating room. What we know with COVID or coronavirus is that people who are asymptomatic or pre-symptomatic, that is in the days before they get symptoms or sometimes they never get symptoms at all, can still be contagious and they can spread the disease, sometimes to lots of people. So there's this story in New York about this lawyer who spread it to over 50 people when he was feeling well, a story about somebody in Connecticut who spread it to 40 people before they got sick. So the thought is that if you wear masks before you're sick, you may prevent spreading it to other people. So again, the mask is not necessarily to make you better, but it's to help you prevent from spreading it to others. So masks are uncomfortable, but they can be worn. This is a tie-on mask, which actually is a little bit better than the loop masks, but a little bit harder to tie behind your back if you're not used to doing that. So this is a mask. We've also come up with instructions on, if you have these masks, how to launder them. Typically, we recommend that people launder them in warm water with laundry detergent, then to dry them on high, let them fully dry. Sometimes they need to get pressed, but usually not, and then they can be worn again. So most people probably would want to have one or two. So again, we're working with a group through Oregon Serographics and Mercy Foundation to provide these for clinics and EMS. There are other groups in town who are working to provide them for people in the community. I spoke with them today. We're not sure how that's exactly going to work because this recommendation just came out this afternoon, but we're going to work in a way to get these masks to people in the community who want them. In addition, there are some good patterns on making your own if you have a sewing machine. But my wife tells me they're not super easy to make, but most people could learn how to do that. So that's the story on masks. If people have questions about masks, please send them to the comment section, and we'll do those. Actually, I have some sobering news about the coronavirus itself. So we've today, over the last 24 hours, reached 1 million cases in the world. I mean, back a few weeks ago, when we were talking about 70 or 80,000 cases in the world. It seemed like that was an enormous number, but 1 million cases and almost 100,000 new cases today. So this is really, really, really taking off worldwide. And we also hit 50,000 deaths. So at 50,000 deaths, this is really, truly an important thing. And most of these deaths are people who were doing reasonably well beforehand. So it really is a grave thing. In Oregon, we're doing a little bit better than the rest of the country. Our growth rate is still high, but lower than in the rest of the country. And in Douglas County, we've stayed at 10 all week. Now, if you've been following the OHA site, it's a little confusing. It was 10-9. It's going to go back to 10. It's all the same number of cases. There's one person who lived in Douglas County and went to a different county. Lane County, they've announced. So they went to a different county, and it wasn't clear which county they were living in. So it's gone between 9 and 10, but it really is just the same number of cases. So the first one is, could this virus be airborne? And the answer is we think probably not, because most coronaviruses go in droplets. However, it can be airborne if you're going to do an aerosolizing procedure. So if somebody is coughing very hard, if somebody is doing a breathing treatment, if you're intubating somebody or suctioning them, we think what happens is the virus now becomes aerosolized and become momentarily airborne. However, walking down the street or being in the grocery store, it's unlikely that it would be aerosolized. So on Wednesday, you said the nose swabs have a 40% false rate. How many people then do you think have it here? So it's called a 30% false negative rate. So they're both false negatives and false positives. We don't think there are very many false positives. We think if the test comes positive, you have it, because this test looks for very specific parts of DNA that you induce, but it probably has a 30% false negative rate. So that would suggest that if we have 10 cases that we've known here, that there are probably something like 15 cases among the people we tested. Now, are there likely more cases in the community? Absolutely. Because remember, about 40% of the people who have it are asymptomatic. And since we haven't swabbed any asymptomatic people, we've likely missed those. And we're just taking people who have fever and cough, the ones who are most likely to have the virus. But there are clearly a lot of people with mild symptoms who may have the virus. So if we had to guess in Oregon, we would think that the number of cases we've found with the amount of testing we've been able to do only catches maybe a third of the positive cases. So somebody says, I have a necessary doctor's appointment coming up. I'm healthy. Should I wear a mask? So the story on this is, if you can do it by telehealth, please do it by telehealth. And you can do most visits by telehealth. If you can't do it by telehealth and need to go in, should you wear a mask? I think the recommendation from the CDC today is yes. But not necessarily to prevent you from getting an illness, but maybe from the provider. And the provider, you might ask the provider to wear a mask too. So my husband is 72 and has vascular heart disease. Should he be working? This is a very interesting question. So one of the questions that, certainly as you get older, your risk of dying is higher, although your risk of getting the disease is probably the same as a 20-year-old. But a 20-year-old probably have the same risk of getting the disease, but a much lower rate of dying. So I'm in my 60s, my kids are in their 20s and 30s, and somebody said, well, geez, if you had to do something dangerous, we really should send the kids in because they have a much lower rate of dying should they get the disease. And I said, whoa, back up the train. As a parent, I would, I've lived a pretty nice long life. I would so much rather I go in than my kids because, my kids still have a long life to live. They've got young kids to take care of. So it really is a very much individual decision. I've talked to maybe a dozen people this week who've asked advice, and there's been some things in the ethics columns about what you do. And I think what we come in the end is this is really an individual decision. I mean, Fauci's 78 years old, and yet he's working really hard. There are younger people who decide that the risk is too much. So I think this is an individual risk assessment. If your husband is 72, he clearly is at some risk, but if he wants to work, I think this is really an individual decision. Similarly, if you're 40 and have a health condition and think it puts you at high risk, you may not want to work, but again, it's a really individual decision that I don't think I can make for anybody else. Do you recommend a pulse oximeter? I've been hearing a lot about them. Well, pulse oximeters are amazing little things. They're like this little laser light. And they first came out in the 80s when I was a young doctor. And they were like the most amazing things because it was this laser light that told you what your oxygen level was. And they're really actually pretty amazing in doing that. Pulse oximeters are very good at telling what your oxygen level is. Most people don't need an oximeter. However, at some point they may become like thermometers, like you'd measure your temperature, you'd also measure your oxygen level. It's interesting, even the watches now measure oxygen levels. Are pregnant women more likely to get it and it's worse on them? Jessica asks. New study came out just yesterday, suggested that pregnant women are just as likely as anyone else to get it, but it doesn't seem to be any more serious in pregnant women, which is really unusual because most infectious diseases are. So do we know where local people got the virus? And the answer is no. What we do know is they didn't get it at the same place because we went back during the time that they were likely infected and there was no places that they shared. Some of the people who got it had traveled to other places in the United States before they got it. So they likely got it while they were traveling at other places in the United States. But again, we looked very carefully to see, were they all at the same restaurant on some day, or did they all go to the same event or whatever, and not. So if one is asymptomatic, when does the virus go away? This is a confusing question with this virus. We know some people can carry this virus for weeks or months thereafter, well after recovery. On the other hand, there are other people who no longer shed the virus but continue to be symptomatic. So the end of symptoms and the end of viral shedding really don't correlate very well. Can you remind people not to be using Swiffers as a filter in their air masks? Yeah, I know people have used all kinds of different things as filters. The only three things that are recommended are tea towels, fabric interfacing, and vacuum cleaner bags. Swiffers are not recommended. So how long should we have a fever and a cough before we talk to a telehealth doc? That was hard to say. So how long should we have a fever and cough before we talk to a telehealth doc? I think if fever and cough persists more than a day, certainly if you have shortness of breath, I would talk to your doctor. So where can we get masks for retail workers? So again, there are going to be a number of people in town who are making these right now through Oregon Serographics and Mercy Foundation. They have just enough for the hospitals and the clinics. But I will hope over this next week, and especially with this thing from the CDC, that all those crafters around town will be making more and more masks, and that we'll have them now for retail workers as well as other people who want them. So do doctors initially test for flu first? Is there testing outside the drive-up testing clinic? So for the first question, is the recommendation in the past had been checked for flu first because many of the people had a flu-like illness? At this point, that's not required. And is there testing outside the drive-up testing clinic? And yes, any doctor can order and do testing. The problem is for most clinics, they don't have the swabs and they don't have all of the protective gear that they have. And so they aren't doing them, but they certainly can do them if they want. And there are a couple of clinics in town that are doing that. But generally, the testing clinic is the most efficient way to do it. It's very fast. All of the labs get sent immediately to Quest Lab, and we have all of the proper protective equipment as well as the optimal kits. So what advice do you have for business owners who are tempted to reopen with social distancing and fewer than 10 people in their stores? So when you look at the usefulness of certain measures, so one of the usefulness, stay home alone. That's really useful. You will not get the virus if you stay home alone. The next most important is social distancing. So social distancing, staying 6 feet away from somebody, is really quite effective in preventing the illness. And then wearing a mask, slightly preventive. So I would always do those things in that order. If you can stay at home, stay at home. If you have to go out, stay 6 feet away. If you stay 6 feet away and want to have extra, use a mask. So this question about when we open the economy and when we do this is a very complicated one. I'm certainly not going to tell business owners what to do. I made this deal. If business owners won't tell public health what to do, public health really won't tell business owners what to do. In general, I think, however, it is safe if there's good social distancing and you don't have a lot of people crowded in the store. So Stacy asks, with such a high false positive rate, why are patients taken out of isolation after negative results? So the answer is it's a high false negative rate, but that would be the same question though. Why are patients taken out of isolation after negative test? Well, they can be taken out of special isolation after a negative test, but they should still have precautions. So clearly, if anybody has a respiratory illness, people should be wearing a mask, both the patient and others. So can we make our own ventilators? What about ECMO machines, Mitchell asks. Well, if this is the Mitchell I know who's so smart, he probably could make it. He's like MacGyver. But ECMO machines, which is called extracorporeal membrane oxygenation, are incredibly complicated machines. Basically, it's a heart-lung bypass machine that happens when you're having open heart surgery. These are very, very complicated to make, and I don't think there's any way you could make them at home. Could you make your own ventilators? Maybe. There are actually a couple of things on the internet about making these with motors, windshield wiper motors in a bag. So maybe you could make ventilators like that. They would be obviously quite crude, but you might be able to do that. ECMO machines, there's only one Mitchell I know who could do that. So why not use colloidal silver prophylactically and at the onset of symptoms, Wendy asks. And so let me start a little bit here. So people have said that, a couple of people have noted that I've been sort of critical about different kinds of treatments, both alternative medical treatments and medical treatments. And the answer is, I wouldn't say I'm down on those things. I would just say that what I'd like to say is, if we have data that something works, I'm all for it. If we don't have data that something works, I wouldn't recommend it. So we've had people recommend things. In fact, the FTC has sanctioned some people for claiming that things work to prevent coronavirus when there's no evidence they don't. Now, nebulized colloidal silver is one of those things that has lots of proponents. I looked that one up specifically today. There's no data on that one for coronavirus. So there's no data, and that's basically what I can say. Colloidal silver is really interesting that silver does have some antibacterial properties, might have some antiviral properties, but again, it's not been tried. So the thing to do, and what I'm always asking people to do, is to do a trial. I mean, there's clearly enough people around who are sick with this, and the right way to do it would be to have 200 sick people, with 100 use nebulized colloidal silver and with 100 not, and see if there was a difference. And if there was a difference, then we should do it. If there's not a difference, or if there's harm from it, then we shouldn't. So what I'm just saying is that there's not studies out there, and without studies, I don't want to recommend it, but I do want to recommend that people do studies. So we'll go through here. There are a couple things I wanted to cover if we don't get questions. But one is, should we sanitize our groceries before putting them away? Again, we don't think surfaces like that are really a high risk. But if you really want to be cautious about it, what I would do is wash your hands well before you do it. If you want to wear rubber gloves to do this when you put them away, that's fine. Take the gloves off, wash your hands again, and you should be fine. So Misty says, I live on the coast and have neighbors who live here part-time, so no primary care doctor. Can we still get tested, and where? So the idea on getting tested is that you need to be a resident of the county. Your doctor doesn't need to be a resident of the county. So if they're part-time residents here, they could still do it. So Tammy asks, what's your opinion of shutting down cities versus staying at home orders? So everything we do, so Oregon is stay home, stay healthy, sort of a mid-range thing. Some cities are on total lockdown. You're not allowed to go out except for essentials. And then some places have had very mild restrictions. The more tough the restrictions, the more likely you are to prevent the spread of the disease. But the tougher the restrictions, the harder it is on people. So the harder it is on business owners, the harder it is on others. And so that's a very complicated decision. I think what Oregon has done has not only been fairly reasonable, but it's also worked, because our rate of spread in Oregon is far lower than almost any other state. So I think Oregon did, in this case, guessed well. So statistics show that we should prepare for the worst of the pandemic in the next 3 weeks. Is the hospital ready? Well, I think you're right. I think April is going to be the bad month here. I think by May, we may be kind of over this. And is the hospital ready? The hospital is as ready as any hospital could be. They've canceled elective surgeries. They've kind of cleaned out everything else. They've made an area for patients who are positive with COVID. They've changed their ventilators and anesthesia machines to be ready. They're training staff to go ahead and take care of people. They've been careful with their PPE. So I think of all the things that could be done, they've done it. So Betsy asks, why are the tests taking so long? If I only knew. So the tests are taking long because the tests done by the major labs are done with machines that take a few hours to do them. But that's not the reason they're taking so long. They're taking so long because they're backing up. So that there's a limiting factor on the amount of cartridges for these machines. And so these cartridges, take so long to do it, and the tests get backed up going into it. It's only when we get enough capacity that the machines aren't running 24/7 and all the cartridges aren't being used that we'll be able to do the reasonable amount. So these tests should, at the longest, take overnight. And it's not because it takes long. Now, some tests do take a long time. So one of the tests is like a urine culture. People say, how does that take days? Because you take a little bit of urine, you put it on a petri dish, on agar, and you wait for it to grow. And bacteria only grow as fast as bacteria grow. So it takes hours for the bacteria to grow, or blood culture takes days for it to grow. So in some tests, it really does take that long. This one, even the longest test only takes 4 hours. And the reason it's taking so long to get the results back is not because the test takes so long, it's because there's a backlog of tests. So do our numbers include presumptive cases? Well, we've gotten rid of the word presumptive. So all the cases that we have are cases. We used to do tests and then have them confirmed with the CDC. There's no way that CDC can do that many confirmatory tests. So now we're considering all of our cases to be cases. How many masks does one person need? Well, if we're talking about the cotton masks here, I think, depending on how often you do laundry, 1 or 2 or 3. Do we need to do mandatory stay-at-home? There are so many people out shopping. Well, mandatory stay-at-home is really hard, right? Because mandatory stay-at-home means that you better have enough groceries to last you for the week. Many people don't have that. I think if you have good distancing, we don't have to have mandatory stay-at-home. But again, that's a question for the politicians. So is it safe to use bar soap instead of liquid soap? Absolutely. So bar soap works great. Anything that makes suds is great. This virus is a combination of proteins, DNA, and lipids. And what happens is, like all soap, it breaks down lipids, so it breaks down fats, and that's the way it works. And does it need to be antibacterial? It does not need to be antibacterial. Good old Ivory soap works. So the length of time from the beginning of symptoms to recovery, Linda asks. This is really variable, right? There's some people who don't have symptoms at all. There's some people who have symptoms that last just a few days, and then people have symptoms as long as 6 weeks. I think the average is that people are feeling much better by the 13th or 14th day, and then the cough lasts a few weeks after that. So is there a protocol to notify other counties if positive cases have traveled to them, Michael asks. So yes, so the story is if we have somebody who's got to contact another case, we contact that other case. So is there much risk in handling money? So money, somebody spits on the money and then you pick it up and then touch your eyes, there's maybe some risk there. I don't think there's a tremendous amount of risk. The risk is touching something and touching your face. So if you notice with the mask, I touch my face a few times. Otherwise, I don't touch my face. So I'm not sure how safe masks are going to be for the person having them. So in a retail environment, if you want to wear a mask in a retail environment, I think that's totally reasonable. So I think that's not unreasonable. Jackson County is recommending that everyone wears a mask. If I'm an essential employee, should I be wearing one? So this is so confusing because the data now varies from President Trump saying you should wear one, but he doesn't want to the state saying, well, there's no recommendation to do it, to Jackson County saying there's recommendations to. So I don't know. So is there any validity studies about hydroxychloroquine from China? Are there any stats from here in the U.S.? So the stats from here in the U.S. are anecdotal. So anecdotal means, hey, I took care of 10 people. I used chloroquine. I thought they did well. That is always confusing because when you do that, you can be biased by seeing a small number of patients. So really, with a death rate of a few percent, you'd have to treat hundreds of patients before you knew whether it made a difference in the death. So the stats from here or the anecdotal stories here in the U.S. range from it's the greatest thing in the world from a doctor in upstate New York to it doesn't seem to help at all from a doctor in New Orleans. So it's all over the map. The hydroxychloroquine studies in China, very small study with only 30 on each arm. It showed that it was maybe slightly helpful, but certainly not magic. So if somebody moves here, should they be quarantined for 2 weeks before we see them? Well, you should be staying at home and not seeing them, right? So that's the goal. However, if after 2 weeks in quarantine, if they're well, the risk of seeing them is low. So I have one family that I talked to had a kid who was coming home from college. They desperately wanted to see their daughter, and they wanted to know what the safest thing to do was. Well, the safest thing would be to quarantine her for 2 weeks, and if she's still well, then to do it. So that would be the safest way, but it's not mandatory. So I also want to talk about vaccines. So we've had questions about vaccines. I think the good news today is that there was a report of a vaccine that seemed to work in mice, which is really good for mice. But vaccines that work in mice don't always work in people. But sometimes vaccines that do work in mice also work in people. So that was pretty good. So if it's not airborne, how do asymptomatic people infect others with no sneezing, cough, or fever? It seems to be just in the respiratory droplets that people make even when they're not sick. So people, even when they're not sick, still make respiratory droplets. They don't make quite as many as when they sneeze or cough, but they still make respiratory droplets. Yeah, so the story is this asymptomatic transmission is really unusual. We don't think that happens in very many other diseases. So we're trying to figure out this asymptomatic transmission. We're also trying to figure out the super spreader phenomena, right? So in most diseases, you'd infect 3 to 5 people maybe with a disease. This one, some people were infecting many people. So in Korea, one woman, they think, infected over 200 people, and she wasn't very sick. So do droplets travel through air ducts? Well, they tend not to stay more than about 6 feet. So the droplets we're talking about stay about 6 feet and then come down. So in a very short duct, maybe, but most ducts tend to be many, many, many feet long, and so probably not. So rumor has it, someone's cousin has it and lives in Coos Bay. Is this true, or the reported report case? We're not going to release any details about any individual cases. All of the contacts of all of the cases have been contacted. So if they haven't been contacted, the answer is no. So is our lack of new cases due to lack of testing or waiting for results, or people being tested or just staying home? So we're doing a good amount of testing. So the amount of testing that you want to do is about 600 tests per 100,000 people. So that's about what Italy did, what Korea did, and whatever. We're at about 350 tests per 1,000 people. So we've done a lot of testing. So there's a graphic I looked at today about the amount of testing that's done in the state. We're doing a lot of testing here, so I don't think it's from a lack of testing. Waiting for results. We're waiting for a few, but even at the highest rate, that would only add a few cases here. I think the lack of cases because people are doing a very good job of social distancing, and because Douglas County is not an area we have a lot of people with international travel, and because we can be relatively far away from people, I think it's just those things that are making it. I grew up in New York City, so you probably can't tell, but New York. And so there, people crowded everything. Even the streets are crowded. You wait for a long time in the subway. You're there with hundreds of people. You're then in a subway car with 200 other people who are right in your face. So people who live in urban areas tend to have just a lot more contacts than people who live in rural areas. And so I think that's why you've seen this spread mostly in cities and much less in rural areas. So I think people are being tested. We're testing in Oregon at a very good clip, but I think they're staying home is doing it. So if you already take hydroxychloroquine for something else, will it hurt you or protect you from the virus? We don't know. This is going to be a fascinating thing to look at. We do have a number of people who take hydroxychloroquine. You can use it for malaria, but very few people use it for that. But it's also a very good drug for arthritis. So I actually have a few kids who take hydroxychloroquine for their arthritis. And what's going to be fascinating to know is when we get through this and we do antibody tests, and we look at people who took hydroxychloroquine and then other people with arthritis who took a different drug, to the people who took hydroxychloroquine, were they prevented from getting it? And that is a great study that would get you maybe a Nobel Prize. So is there a blood test? Yes, there is a blood test. I just before we got here today saw it, Henry Schein is a company that many people use as a distributor. They're having it. They still haven't distributed it yet, but it's a quick pinprick of blood on a card, and you get the results in a few minutes. So yes, it's going to be there. They haven't shipped it yet. So explain what recovery from COVID-19 is. This is another way we in public health have not made it any easier. The definition of a case is a positive PCR test. The definition of recovery varies all over the place. Some places say that if you're 7 days from hospitalization, you're recovered. Some places say if you're 14 days from onset, you're recovered. Some places say you have to have 2 negative tests, but symptoms don't matter. Some places say you have to have an improvement in your symptoms. And some places say you have to have all symptoms gone. Oregon is leaning towards, hasn't made a decision yet, is leaning toward resolution of all symptoms, which is the latest thing out generally. So that's why the number of recoveries in Oregon is small and people aren't publishing it. We have 1 recovery. So this is another question Linda asked. Does an ACE inhibitor, blood pressure medication, and there are a lot of ACE inhibitors, lisinopril, Acupril, that work on the ACE receptor in your lungs. And so there's this thing called angiotensin converting enzyme that's in your lungs that causes something called angiotensin and renin that increases your blood pressure. And what ACE inhibitors do is they block that enzyme so you have less renin and less increase in blood pressure. This virus attacks the ACE site in the lungs. So there's been great interest about what ACE inhibitors would do with this. And just like that thing before about whether hydroxychloroquine will change your disease, the story is, will ACE inhibitors change either your susceptibility to make you more susceptible or less susceptible or more sick or less sick? So far, there's no data that does any of those, but this will be fascinating to see. So will eating healthy and having a good immune system make a difference in contracting the virus? We don't know for sure, but eating healthy and having a good immune system is always a good thing anyway. So sleeping right, getting some exercise, eating good, healthy diet is good for every reason. So where do I get my information? So I read 2 journals every week, which is the New England Journal and JAMA. There are 6 medical newsletters that get the best articles from around the world. So I do the 2 journals and the 6 abstracts. There's another thing called Up to Date, which is a peer-reviewed sort of the doctor's internet. So you pay like $500 a year and you get these things which are filtered and done correctly. And so we get there. So Up to Date, these 6 digests and these 2 journals, and I'm reading all the time. So Heather asks, is there any guess when we get back to normal? And so this is a difficult question. So again, remember what we're trying to do with this is we're trying to prevent all of these cases from coming at once. I don't think any of us think that we're going to have a time before a vaccine where there's no cases. But if we had 100 cases a month in Douglas County, that would suggest we would have 20 hospitalizations, 5 people in the ICU. That would be back to kind of normal. And the question is, when will we get there? I don't know when we'll get there. I would think it's not going to be in the next month because I think April is going to be a pretty nasty month. And then before we get back to normal, we're going to need to be sure that all that PPE, that protective equipment that we're so short on, gets built back up. Because by the end of April, most places will be nearly out of it. And if you let things go back to normal and there was a big surge in cases, you wouldn't have any PPE to take care of these people. So you've got to do that. I think the other thing is you have to have plenty of tests with a good turnaround time. This getting a test result back 5 days later is not going to help. You need to be able to do the test, get the result within a few hours or at the latest by the next morning. And then you're going to need enough public health people to track all these positive cases down so that we can surround people and be sure they don't spread it. So I don't see that happening for another couple of months. So the other question is about testing. So the good news is there's two kinds of testing. The blood testing, I said that I've seen it available and it's supposed to be shipping soon. The other one is sort of the rapid testing. And I think more of the rapid testing has come online now. There are now 3 of these companies that have rapid testing. And so the hope is that we'll have more rapid testing, 1 or 2 hour testing in Douglas County. Initially, we're going to use that for hospitalized people, because for hospitalized people, that really does make a difference in telling what your prognosis is going to be. But hopefully, once we get enough for the hospitalized people, then we'll have enough for the rest of us. So what's our plan to keep the hospital from being overwhelmed? Well, our plan is to keep the number of cases in Douglas County low. So we think that when the hospital has more than about, it says 180 beds and 16 ICU beds. So once you have more than that, that kind of gets the hospital overwhelmed. Now, they've made space in other areas. They've got rid of other patients to make more room. We have those all kinds of other plans to take care of patients who are not that sick in other places. But at some point, the hospital could get overwhelmed if there were enough cases. So since about 20% of the people get overwhelmed, 20% of the people get hospitalized. If we had 1,000 cases in the county, and that's why I have been using the shorthand, if we have 1,000 cases in the county over a month, we'll have 200 admissions and 50 people in ICU, which is more than Mercy can handle. And that's why we want to keep the number of cases in Douglas County to less than 1,000 a month. We're just at 10 now, but that's great. But New York State went from 100 to 100,000 in the space of 3 weeks. And that's what we're trying to prevent, that incredibly rapid rise like they saw. So Loretta says, it seems that China reopened their economy and the virus is showing back up. Is that true? That is definitely true. So what happens is they had this total lockdown and they were able to get the virus so that they were having very, very few new cases. But now as they've opened up the economy, they're starting to see more cases. But the number of cases they're seeing is small. They're seeing cases in the hundreds. And in the hundreds, in a country of 1 billion, you can go ahead and keep that under control because they have a lot of tests. Right? They did all of these tests back in January and February, and they're continuing to make the tests, so they have plenty of tests. They can get the results back in a little bit, as well as they built all this extra hospital capacity. And so by building all this extra hospital capacity, they have the capacity to take care of them. And they've been about 4 weeks since they've had a lot of cases, so they're building back their PPE. So just like China is being able to open up their economy when they meet those criteria, declining number of cases, adequate PPE, lots of testing, and public health workers take care of them, they're opening up their economy. I think it's going to be kind of the same calculus here. So there are a couple of things I wanted to talk about. One was stigma. And so we're going to post this lovely video next week about stigma. And, there's a real concern that people who have this virus are getting criticized and ostracized. Chinese Americans are reporting all over the country that they've been treated badly because they say they were somehow responsible for the virus. It's really hard to see that, how a Chinese American could be responsible for this virus. I mean, we think this was bats and pangolins in China. Really, Chinese Americans are not, but yet they're facing this stigma. Similarly, we saw a story early this week where people put notices on people's doors. People are going to kind of figure out who that person is who might have this because they can hear them coughing and the stigma that arises from that. Please, please, please. The people who get this are not at fault. The people who get this are people who get this. Certainly people in nursing homes, it's not their fault when they get this. If somebody who's caring for somebody in a nursing home gets this, it's not their fault. So really we have to work to decrease stigma. I see the cases. I see the questions are failing here. I'm going to talk about one more thing. And then if we get no more data, we'll say we're done. So again, the masks, varying recommendations about wearing them or not wearing them. Again, the deal on masks is they're not so much to protect you, but to protect from other people if you're in that pre-symptomatic or asymptomatic phase. We say on the masks, if you want to wear them, great. If you don't want to wear them, you shouldn't feel like you're not doing well. Most important thing, stay at home. Clearly stay at home if you're sick. And social distance. Again, if you can touch people in your daily life, you are too close. Well, that's it for questions. 6:39. Again, this is Dr. Bob Dannenhoffer. Thank you for doing this. We'll do this again next week. Thank you.